Hi, I'm Dr. Malpani. I'm an IVF specialist. And one of the things which often frustrates me is the poor quality of care which infertile couples get. Part of the reason for that is the care is often not holistic. Instead of going to an IVF specialist or an infertility specialist, they will directly go to a gynecologist because the gynecologist, in one sense, is the primary care doctor for the female patient. The trouble, of course, is that gynecologists are often not well informed about male factor infertility issues, and this is a very common problem we see, which means because the gynecologist doesn't know how to treat the infertile man, the care for the infertile couple starts getting fragmented. So typically the gynecologist will focus on what they do know, which means they'll do the test for the wife, and unfortunately they'll do too many tests. Some of the tests are ridiculous. And the tragedy is some of these will actually routinely do surgical procedures like hysteroscopies and laparoscopies, which are very profitable for the doctor to do, but are completely pointless for the patient because you can get exactly the same information by non-surgical methods. For example, if you want to find out if the tubes are open, you can do a simple hysterosalpingogram. So there's no reason to justify subjecting the patient to a procedure. Now, a lot of doctors will say, oh, it's just a laparoscopy, it's a single cut, it's minimally invasive, and of course every operation is minor for the doctor. There's no such thing as a minor operation for the patient. The same thing applies with hysteroscopies. They say, oh, we need to look inside so that we can pinpoint what the problems are. And again, you can get exactly the same information with a vaginal ultrasound scan. So be careful when the doctor starts advising too many tests and too many treatments which are not required at all. But this is a common tendency amongst gynecologists. What's actually even worse is that if you go to a gynecologist, they do various treatments, it doesn't work, and you get fed up and you go to a new gynecologist. The new gynecologist insists on repeating all the tests which the earlier gynecologist has done by saying, oh, that earlier gynecologist wasn't good, I don't trust his ultrasound report, I don't trust his laparoscopy report, I don't trust his hysteroscopy report. So the poor patient is treated like a ping pong and goes from one gynecologist who does all the tests to a second gynecologist who repeat the test to a third, and no one's really offering any effective treatment at all. And this is a big problem, especially when it's the man who has a problem, because the gynecologist refers to the andrologist. The andrologist doesn't have much useful treatment to offer, so he often does varicocele surgery, which doesn't help. Then he refers the patient back again to the gynecologist, at which point either the gynecologist gets fed up, or the andrologist gets fed up, or the poor patient gets fed up, and then they look for new doctors, and then the saga keeps on continuing. I think that's why information therapy is so important, and that's why patients need to learn to ask the right questions. Because if you don't ask the right questions, let me tell you, you're not going to get the right answers, and that's not going to help you at all. So what happens when the man has a low sperm count and the andrologist has done the varicocele surgery and the count remains low? He goes back again to the doctor, and ideally the doctor should refer this patient to an IVF specialist for IVF ICSI, because the only effective treatment for the man with a low sperm count is ICSI. But gynecologists are reluctant to do that because they want to hold on to that patient. So they will then say, yes, you don't have very good sperms, but you know what we'll do for you? We'll wash your sperms, we'll process your sperms, we'll extract the good quality sperm from your sample. We'll do this in the lab. And some of these gynecologists don't even have their own lab, which means they need to refer the man to an outside lab which processes the sperms, washes it, sends it back again. And obviously this is not very kind for the sperm. So by the time the sperm goes back to the gynecologist for the procedure, the quality is kept on deteriorating. But the fact of the matter is that if these are poor quality sperms, washing them will not improve their quality. Sure, by washing them, you're concentrating them down into a small volume of culture medium, which means it becomes easy for the gynecologist to put the washed sperm directly in the uterus. And that's what the gynecologist says. We'll wash your sperm, we'll process them, we'll make them better quality, we'll put a small volume directly in the uterus so that we're taking a shortcut, doesn't have to go through the cervix, so that the chance of the egg and sperm meeting is increased because you put the sperm directly in the uterus. Which is fine for a certain group of patients, particularly those with unexplained infertility or for those with secondary infertility, where the sperm have proven their fertility. But for men where their sperm quality is not very good, especially for those with poor sperm motility, the problem is that you can't solve this by just washing the sperm and doing an IUI, because poor quality sperm will remain poor quality sperm even after washing. You'll artificially increase their concentration, you may artificially increase their motility, by changing the swimming medium from the seminal plasma into culture medium, which is obviously less viscous, so the sperm will swim faster. But that doesn't mean the fertilizing ability of the sperm improves at all, and these sperm will not be able to fertilize an egg. The trouble is the doctor will not tell you the truth. The patient has no way of judging that, because the only way of finding out if sperms can fertilize an egg or not is by actually doing IVF in the lab, and the gynecologist doesn't have the ability to do that. So they keep on doing IUI after IUI, and when the doctor gets fed up or the patient gets fed up, the patient just goes to a second gynecologist who again repeats the IUI cycles. So now we've actually seen patients who've done 6 and 7 and 8 IUI cycles, and they're completely fed up and frustrated, whereas all this time what they actually needed was IVF ICSI treatment. And the tragedy is they're no longer willing to do it because they're fed up. They don't trust any doctor. They don't understand the difference in a gynecologist and an IVF specialist. And because that trust in the entire medical profession has been frittered away by gynecologists offering the wrong treatment, they've got so fed up that they won't trust anyone. And the worst thing is the wife has progressively got older, which means even if she then chooses to do IVF ICSI, the pregnancy rate with IVF also will have dropped because she's got older and ovarian reserve has dropped. So if you don't want this tragedy to fall on your shoulders, please get a second opinion from us. Our website is www.drmalpani.com. We've got hundreds of videos and lots of pages of information to provide information therapy so you can differentiate between a good doctor and a bad doctor and make sure that your doctor is providing you with the right medical advice. We're happy to offer you a free second opinion by email on our website. Look forward to seeing you online.